is a condition, that inflammatory condition, that is going to affect the structures that support the teeth. And then, as you all know, we all have bacteria in our mouth, but periodontal disease it's like some specific bacteria that will be in the tissues that support our teeth, and then it will create disease around it. This may lead to mobility of our teeth, and then if we don't treat it, then we can lose our teeth and the structures that surround these tissues. Let's see if it works here. So the next one that I'm going to show you is just an image showing you the difference between healthy tooth and a tooth with periodontitis. So as you may know, itis means inflammation. The suffix itis is inflammation, and then periodontium is where the name of the tissues that surrounds the bone. So periodontitis, it is known as inflammation of the tissues that surrounds the teeth, which is the bone. And then we can see here, this is, if you cut the teeth in half, then you may see that, well, this is the pulp that has all of the nerves, then we have the dentin, and then we have the enamel, the outer surface of the teeth. And then surrounding the teeth, we have some bone, we have the gums, the gingiva, and then we have some fibers that helps attach the tooth to the bone and keep it like still in our mouth. But when we have periodontitis, then you can see that the bone starts to get reduced in here, resorbed, and then we can also see some calculus in here. So some signs and symptoms that you should take into account if you feel that you may have any of these diseases. I'm going to explain two main conditions that we have whenever we have periodontal disease. And so we have, if you feel that your gums are bleeding whenever you're brushing or you're flossing your teeth, you may see that your gums, they look like this bright red color or dark, sometimes even dark purple color. They may feel tender, they may have a sensitivity to hot and cold drinks or foods. You can see that there is some calculus or plaque that gets into your teeth. And you can also see that your gums starts receding, which means that they're going like up, as you can see in this photo, that the gums are starting to go to recede. So these are some signs and symptoms of periodontal disease. Within periodontal disease, we have, Rin, can you go to the next one? We have gingivitis. So in the first one, we have gingivitis versus periodontitis. For gingivitis, it's mainly inflammations of the gums. And in this one, you may see bleeding whenever you're brushing or flossing your teeth. But what is like the difference between gingivitis and periodontitis is that gingivitis is a reversible condition, which means that if we improve our oral hygiene habits and we have periodic cleanings, then we can go into we can have a healthy mouth. But if we don't take if we don't have the regular oral hygiene habits and we're not having these regular or periodic cleanings, dental cleanings, then we can move into a stage that is called periodontitis. As I was showing you in the image before, periodontitis, we have, besides that the gums are inflamed, we can also see that the bone is starting to recede. And once we have bone that is get lost in our mouth, it won't regrow again. So we are going into it's getting worse every time. So these two, the last two images in the bottom, you can see this one is a moderate stage, where you can see that the bone is not, this is health, and then in this one is starting to get the disease in here, right? And then if you go to the last one, you can see that the bone is, sorry, it's gonna go here. It's already here. So this is very severe, like very advanced condition. If you are in that condition, you may feel your teeth are moving. Whenever, even if you're not eating or something, they are just moving at all times. And of course, besides you have bleeding, you may feel some calculus in your teeth. So just some conditions for you to be aware of. If for people that have implants, they can also have like these diseases around the implants, and then we have peri-implant mucositis, which is like the gums inflammation when you have an implant, and then same for peri-implantitis, which is periodontal disease so bone loss around the implant for people that have implants. You can see here that there is like a shadow around. So if you see, this is normal bone on a radiograph, and then you can see here that it's like this is bone, all bone loss around the implant. So that's peri-implantitis. Yes. Now Rin is gonna talk you about regarding the population that is at risk and some risk factors. Thank you.
Okay. Thank you for the opportunity. And now I'll be going over the risk factors and some the population. Sorry. Yeah. So globally, about 20 to 50% population have periodontal disease. So it's very prevalent, and it's seen in almost about 50% of the population worldwide. And this is a graph based on a study which was conducted and showing the distribution based on the age group, like adolescents, adults, and older people. Next slide. So these are the risk factors, age and gender. So the prevalence, the severity of the disease increases with age. So as the age increases, there is more chance of getting periodontitis. And there was a survey in US which was conducted in 1960. It shows that males are more prevalent to have the periodontitis compared to females. And then genetics. So there are some evidence that genetics plays a role, but it is some studies showed limited evidence as well. So it's not confirmed. Studies are still going on. Then diabetes. The diabetes have a two-way effect on the periodontitis. Those who have diabetes have an increased risk of getting periodontitis. And if a person is having a periodontitis, there is a chance that the diabetes, there is resistance to the insulin, and the sugar level may increase. Next is tobacco use. The smoking, of course, it has a direct relationship with periodontitis. So and it also affects the healing of the tissues, and so there is increased chance of getting periodontitis, and basically the progression will increase due to tobacco use. Next is stress. A direct relation is not proven, but stress can result in inadequate oral hygiene, and that can result in periodontal disease. And then oral hygiene, so we should, lack of proper oral hygiene, of course, increases the deposits in our teeth, and that's the main factor which results in a periodontal condition. That's it now. Pavitra will go over the risks, the facts and myths about the periodontal disease.
So facts and myths are like the brush up of all, which was discussed by Reen and Daniela before. So myth is everyone think that oral hygiene alone, like poor oral hygiene without brushing or flossing, is alone the cause for the gum disease, and they think like bleeding gums usually is not a normal sign. So usually people think that it is a normal sign because of it can happen sometimes. And the gum disease only affects our oral health. It doesn't affect our oral health alone. And then the another myth is like losing teeth is inevitable. Like once the tooth is lost, it cannot be replaced back. And then the other one is like it affects only the older population. And so the gum disease is not rare. It occurs in all age groups and for all age persons. And the last one is like the flossing every day is not necessary. So these are the myths. And we'll see about the facts. So the fact is that the gum disease is like a broad term for two main disorders, like the gingivitis, which is the gum inflammation, and the periodontitis, which is called as the bone disease, which was discussed by Daniela before. And then the periodontal disease is which causes like a serious type of version of the gum disease. It affects the bone. So people who are most commonly affected is the old age groups, but it's not only for the old persons, like it also affects for other age groups if they are not following oral hygiene properly or if they have a systemic health. So systemic health and oral health, they just go in hand. So if the oral health is affected, it can affect the systemic health, and if it's vice versa. And once the tooth is lost, it's not like that the lost tooth cannot be replaced. It can be replaced by the dentist. Like they have many options. And before even the tooth is being lost, you can just prevent it by just going to the dentist, having a regular checkup, and getting the problem solved, getting the teeth clean, and then doing whatever restoration process has to be done. And then having a regular dental checkup is essential because for people who get older and older, their health, like they have to fight against an immune system. So that immune system is also a cause for the periodontal diseases and other gum diseases. So you have to go to the dentist at least once a year, have a general checkup done, and if any cleaning has to be done, just get the cleaning done. And most of all, I believe that the oral health starts from the home. So brushing twice daily, flossing twice daily, having your tongue cleaned because without not using a brush but using a tongue cleaner. You have to clean the tongue because it lodges like more bacteria in the tongue. So you have to clean the tongue as well. And then rinsing your mouth is must. So this is like the basic need that has to be done right at the home so that it can just save the teeth from the other previous diseases. And I'll just move on to the available treatment options, and Nicole will just.
Thank you, Pavitra. So I'm just going to talk a little bit about the available treatment options for periodontal disease, as Daniela and Doreen was explaining before. So there are different types of periodontal disease. There's one called chronic periodontitis that can be focused on one area of the mouth or the entire mouth, which is either localized or generalized. And then there's a type called aggressive periodontitis, where the disease progression is a lot faster than the chronic periodontitis. So for chronic periodontitis, it's a slow progression. It's also the most common type. The treatments for that is non-surgical treatments, such as scaling and root planing. That is basically cleaning the teeth by a professional, where the dental hygienist gets rid of the plaque and calculus that is underneath the gum, and that is causing the periodontitis from progressing further. Sometimes local antibiotics like Arrestin or chlorhexidines, those are adjunctives that are added into the treatment for this. And also oral hygiene instructions. As Pavitra was explaining, it starts at the home, so you have to be sure to brush your teeth at least twice a day, floss in between meals, just to ensure that your oral health is up to par. For aggressive periodontitis, that is the faster progression type. That one is typically genetic or systemically linked. It's also the same treatment as chronic periodontitis, so the other things that I previously mentioned. However, with it being genetically a systemic link, it can be like host modulation therapy. That's where a doctor could prescribe low-dose doxycycline for inflammation. And with this type of periodontitis, you have to monitor it closely, and it can progress to a faster escalation of the progression, meaning it could be so bad to a point where you would have to get surgery done to correct it. So again, with these treatment options, if there's no improvement seen after these non-surgical therapy treatments, a referral would be done to a periodontist for possible surgical treatments. One last type of periodontal disease or periodontitis is acute. That one is more of a sudden onset pain and inflammation. So that's called necrotizing periodontal disease. It's also debridement of necrotic tissue. Chlorhexidine or hydrogen peroxide rinses can also aid in that. Again, systemic antibiotics. If you happen to be a smoker, there is a smoking cessation and nutrition support to help rid it. As well as if you do find a periodontal abscess inside the mouth, drainage and debridement of the area. Again, antibiotics prescribed by the doctor, and possible tooth removal or surgery depending on the severity of how mobile that tooth is. Okay, so we're gonna move on to oral hygiene aids and techniques, and Tenzin will be taking over.
Good afternoon, everybody. So, my name is Tenzin, and I was born in India, but I'm originally Tibetan. So I know like some Hindi. If you guys want me to translate in Hindi, like I can do like slightly Hindi, but not. It's like broken. But I can try if you guys like. So do you guys know about oral hygiene aids? How do you guys take care of your teeth, your mouth? Do you guys know how do you guys brush? Yes. Okay. So first I'll talk about toothbrush. So when we so first it's very important to use a soft toothbrush, and you must brush for 2 minutes twice daily. And so this is how we brush. So you have to tilt your brush to 45 degrees and then go back and forth and sweep up. Okay, so that's how you brush your teeth. And if you're so if your gums are sensitive or have pulled down, you have to brush gently so you don't like brush harder on the gum area. So you have to maintain that 45 degree, okay, and back and forth and up. And it's 2 minutes twice daily, okay, so 2 minutes. And for the toothpaste, you know, usually we use like we usually use toothpaste all over our toothbrush, right? So we don't need that. We only need like a pea size, you know, like the mutter size. So that's all we need on the like toothbrush, and that is like enough to like. And also for the toothpaste, it has to be fluoride toothpaste. So when you go to the market to buy toothpaste, just read the label. It has it says a fluoride toothpaste. So fluoride toothpaste, like what it does is it prevents from having cavity. Okay. And next slide. So have you guys heard about floss? Yes. Okay. Do you guys use floss? Okay. So we have a different kinds of floss. So one of them is like this rusty kind of floss, and then we have like a brush for like if you have a like bigger gap in your teeth, we use this kind of brush to remove the food trapped in between your teeth. Okay, and if you have a limited like function in your hands, we can use that kind of floss, which is like electric yes, water pick. We call it water pick. Okay, and then so what floss does is floss cleans between the teeth where your brush cannot reach. Okay, and then we have tongue cleaner. Do you guys use tongue cleaner? Yes. Yes. Okay. So tongue cleaner. So as you know, the tongue the bacteria can build up on your tongue. So bacteria जब हमारी tongue पे रह जाता है ना, तो हमारी it's very important to just clean your tongue daily as well, not just brush. So you have to like tongue को भी clean करना बहुत ज़रूरी होता है. So क्योंकि वो breath भी होता है ना, bad breath, बदबू आते हैं जो, तो इसके लिए tongue को भी clean करना बहुत ज़रूरी होता है. And then next, so the next we have mouthwash. So mouthwash क्या करता है? It helps lower the bacteria. Bacteria को कम करते हैं हमारी जो मुंह के अंदर होता है, तो उसको कम करता है. But it does not mean that we can. It does not replace the brushing. So brush के साथ ये भी आप use कर सकते हैं, ठीक है? And then जो माउथ वॉश होता है उसको आप अल्कोहल फ्री वाला यूज़ करना ज़रूरी होता है, क्योंकि अगर अल्कोहल हमारी मुंह के अंदर वो ड्राई हो जाता है. सो इसीलिए रोज़ ये अल्कोहल फ्री वाला, लाइक इट विल से ऑन द लाइक द बॉटल अल्कोहल फ्री, तो अल्कोहल फ्री वाला लेना बहुत ज़रूरी होता है. तो नेक्स्ट वन इज सलाइवा सब्स्टिट्यूट. Saliva substitute is for people like जिनके मुंह पे like बहुत ड्राई हो जाता है, जिनके मुंह पे अब थूक कितना नहीं होता है, तो उसकी वजह से saliva substitute आप यूज़ कर सकते हैं. तो saliva substitute is like a special gum or spray. तो जो हमारे मुंह के अंदर like moist और comfortable feel होता है. So that's why like saliva substitute it's important. It will like help protect your teeth by reducing dryness. And also you can drink plenty of water to keep your mouth hydrated. Okay? And next one. Any question so far? No? Okay. So next one, do you guys have a denture? Anyone? Denture? Denture? Okay. And do you guys know how to like take care of your denture? Yes. Okay. So I'll just talk a little bit of about the how you take care of your denture. So denture, so you remove your dentures after eating. And gently clean your denture daily with soft denture. अगर ये brush soft नहीं होगा तो आपकी denture को damage कर सकते हैं. तो इसीलिए denture को ऐसे like you have to hold it like this so it won't break. Okay? और उसके बाद denture को clean करते वक्त toothpaste कभी use नहीं करना होता. अगर toothpaste वो होता है like abrasive होता है तो damage कर सकते हैं denture को. And then denture को आप rinse करना है, rinse dentures well after cleaning. और उसके बाद overnight आप उसके water like पानी के अंदर भी soak कर सकते हैं. पानी नहीं तो like denture solution you get it from your dentist. उसकी उनके पास आप ले सकते हैं denture solution soaking solution भी use कर सकते हैं और नहीं तो water भी use कर सकते हैं आप. और उसके बाद इट्स नॉट लाइक यू नो अगर आपके पास डेंचर हो तो आपके मुंह क्लीन करना ज़रूरी नहीं होता है, ऐसे नहीं है. यू हैव टू कीप योर माउथ क्लीन एज वेल लाइक टंग और लाइक टिश्यूज़ वगैरह होता है ना अंदर, तो आपको वो भी क्लीन करना बहुत ज़रूरी होता है, नॉट जस्ट योर डेंचर. और उसके बाद आफ्टर सोकिंग ओवरनाइट यू हैव टू रिंस डेंचर वेल बिफोर पुटिंग देम बैक इन. ठीक है, रिंस करना ज़रूरी होता है आफ्टर लाइक सोकिंग. और जब आप डेंटिस्ट के पास जाते हो ना, just take your denture with them, they will do a professional cleaning. Okay? Any questions? No. Okay. So now Reem will talk about the summary.
Okay guys, sorry I don't know how to speak in Hindi, so just in English. Okay, so I'm just going to go over the whole presentation. So I know there was a lot of talking, a lot of words, a lot of explaining. So in general, we were talking about periodontal disease. So that is a disease that progresses further than something that's reversible. So once you reach periodontal disease, that means you're starting to lose bone and you can't reverse that. So that's why it's really important to try to stop it before this happens. So the biggest cause of periodontal disease, like they discussed, is the bacterial plaque in our mouth that forms after not brushing or flossing, and it can lead to gum recession, bone, and tooth loss. So with periodontal disease, our teeth can be completely healthy, but if our bone is not there to support them, we can actually lose our teeth with them being completely healthy. So that's why it's really important to take care of our gums as well as our teeth, not just our teeth. So the symptoms of periodontal disease include bleeding, bad breath, loose teeth, recession, and sensitivity. So once that gum comes down a little bit, it exposes more of the tooth, and that causes more sensitivity. So the way we diagnose periodontal disease at the dental office is a clinical exam. So we take a look. We take x-rays to check the bone, the level, and how much was lost, and medical and dental history, because sometimes medication has something to do with the progression of this disease. So sometimes taking medication, diabetes, any heart problems can also affect our gum health. So the treatment is, we do have the non-surgical and surgical treatment for this that they discussed earlier. So it's always obviously better to stop it or to slow it down before it requires surgical treatment, but sometimes it's the best to get surgical treatment to help prevent any tooth loss. So the way we prevent periodontal disease is daily oral care, regular professional care, and lifestyle modifications. So our diet has a big role in our oral health. Regular professional care is very important because as much as we do care for our teeth every single day at home, sometimes there are areas or things that we just can't do at home. So the best, so it's really, really important, obviously, to take care of your teeth at home, but it's as important to visit the dentist regularly as well. So the key findings here for periodontal disease is inflammation in the mouth. So inflammation causes bleeding, causes pain sometimes, and the biggest risk factors for periodontal disease is poor oral hygiene, so not brushing and flossing every day. Smoking is a big one for periodontal disease. It causes a delayed healing, and it causes bone loss. Stress is also another one. Age, because as we age naturally, sometimes we lose bone. We lose bone, and and genetics is the last one as well. So the periodontal disease does have a link between systemic health, like cardiovascular disease and diabetes, like I was discussing before. It can slow our wound healing. It can just kind of affect the bacteria in our mouth. Okay, so in conclusion, periodontal disease is preventable, so we can prevent this disease, but once we have it, it's kind of like you always will have it. You can just maintain it. So early detection of it is very important. So trying to find out that you have this disease early on is really important to not lose your teeth or to cause any more problems. So that's why it's important to visit the dentist very often. And what else is there here? Disease progresses from gingivitis to periodontitis, and timely treatment can stop the progression. So yeah, so like I was saying, gingivitis is like the first stage of this disease. Gingivitis is just inflammation, bleeding, sensitivity, but it does not affect the bone, so you can reverse it back to a normal, healthy mouth. But if gingivitis keeps occurring for a while, then it will turn into this disease that cannot be reversed, but it can be slowed down. So yeah, that's the overview of this whole presentation. Did anyone have any questions about the disease, periodontal disease, gingivitis, anything like that? All good? You guys heard enough talking?
जी, बहुत अच्छी प्रेजेंटेशन थी. Each and everything they discussed